Hello, I am Madison Newton, Senior Manager of Public Health Initiatives at Children's Health Fund. In the following presentation, our President and Chief Executive Officer, Arturo Brito, shares highlights from a fireside chat provided on May 3rd, 2023 at Beacon Healthcare Systems Conference in New Orleans, Louisiana. This video was recorded on August 23rd, 2023 at Children's Health Fund's broadcast room in New York City. Dr. Brito interviewed Mr. Pernell Bryce, Vice President of Policy and Advocacy, and Ms. Jessica Braden, a licensed clinical social worker and mental health provider from the Baton Rouge Children's Health Project, one of our national network partners, on why social drivers of health matter to the health and well-being of children. As emphasized at the conference, while some people call these social determinants of health, we prefer the term social drivers. Social determinants suggests that little can be done to influence life trajectories. On the other hand, drivers suggest people can shape their futures when given access to the kind of care and support our national network provides. Children's Health Fund is the foremost nonprofit dedicated to ensuring access to comprehensive health care for children growing up in some of the most hard-to-reach communities, from urban to rural, throughout the United States. We envision a day when all children in this country have the comprehensive health care they need to thrive and succeed. At Children's Health Fund, we innovate and lead a national network in 15 states, DC, and Puerto Rico to bring comprehensive healthcare, medical, dental, mental, and social services to children growing up in under-resourced communities across America. Our partners deliver services through a fleet of more than 50 mobile clinics, telehealth, and at more than 400 school-based clinics and other community sites. And we translate lessons learned on the ground to advocate for the health and well-being of all children in this country. The Federal Centers for Medicare and Medicaid Services, or CMS, includes 5 domains for social drivers of health: food insecurity, housing instability, transportation needs, utility difficulties, and interpersonal safety. They will be requiring hospitals to submit data around these starting in 2024. Historically, these have not been reimbursable expenses. However, because of mounting evidence and more targeted data collection, public and private insurance providers have in some cases begun reimbursing them. Dr. Brito will now share highlights of the Beacon presentation.
Thank you, Madison. You know, I can still, decades later, vividly recall a conversation I had with Christina, a medical student, when I was the medical director of the South Florida Children's Health Project, one of our national network partners. We had just examined baby Anna Maria and her 6-year-old brother, Carlitos. Gladys, our social worker, was interviewing their mom in the waiting area just inside our custom-designed 38-foot-long mobile clinic. As Christina and I were stepping down the accordion stairs into the all-too-common sweltering heat and humidity of Miami, we overheard Gladys ask the mom, "Do you have a car?" Without hesitation, Christina turns to me and asks, "Aren't we doing too much for these patients?" "What do you mean?" I responded. "Well, as doctors, we're supposed to take care of medical problems, not social ones." I simply said, I appreciate you asking me because this crossed my mind as well. Look, I continued, if our goal is to improve the health of the kids we see, should we address issues like the lack of adequate housing and healthy food? If they're making as much or more of an impact than many of the things we do as pediatricians. So it stands to reason we should focus on these issues. After a long pause, she said, I understand it just isn't what we were meant to do or trained to do. Christina was right about that. However, today we know much more. Social drivers of health must be integral to our healthcare. And to do otherwise is a disservice to our patients and fiscally irresponsible. Our Lady of the Lake Children's Health operates the Baton Rouge Children's Health Project, which started shortly after Hurricane Katrina devastated the area in 2005. The Baton Rouge program currently serves 41,000 public school students, 4 or 5 living in poverty. They integrate social drivers of health into their daily practice, such as ensuring that their patients have access to healthy food. They also have telehealth for parents without transportation or who cannot come to a school-based clinic because of their work schedules. Jessica emphasized that more children and adolescents are coming to their clinic with mental health issues like stress and anxiety. The COVID-19 pandemic has been a big reason, and the economy has made matters worse. When parents struggle to pay rent or to put food on the table, it creates a stressful home environment that their children feel. Jessica noted that students, as a result, are developing poor coping skills, unhealthy eating habits, and suffering sleep deprivation. In her words, they are not coming to school as their best selves. Jessica also cited another major contributor, community violence. In 2021, East Baton Rouge Parish had its highest number of firearm deaths. Jessica points out that this affects not only direct victims and their families, but the broader community as well. When I asked Jessica about the intersection of social drivers, mental health, and community violence, she said, when someone lives in poverty, community violence compounds the issues of housing instability and lack of access to nutritious food, commonly leading to somatic complaints like headaches and stomach ailments that are masking the real issues, the chronic stress, anxiety, or depression they are living with. We need to revise federal and state policy to better address social drivers of health. Cornell introduced two opportunities: incorporating community health workers into clinical practice and bringing healthcare into schools. He explained that community health workers are frontline personnel with an intimate understanding of the cultures, languages, and challenges of the people they serve. They are trusted community members. Research has repeatedly shown that community health workers improve health outcomes, reduce disparities, and lower healthcare costs. As of July 2022, 29 states allow for Medicaid reimbursement for community health workers. 9 state health plans authorize coverage, and another 4 are likely to do so by the end of 2023. The other opportunity Cornell described is the free care rule reversal. In 1997, CMS established the Medicaid free care rule, prohibiting payment for in-school healthcare services available for free elsewhere, except for children with an individualized education plan or IEP. In 2014, CMS reversed the free care rule. Schools could now be reimbursed for services provided to Medicaid enrolled students, even those without an IEP. Makes sense, right? Kids spend most of their day in school, so why not ensure they can receive healthcare services there? But it's up to the states. As of June 2023, 21 states have adopted the free care reversal policy, with 2 more currently in process. In New York, Children's Health Fund is leading the Coalition for Healthy Students to amend state policies to align with the free care rule reversal. If adopted, federal funds would allow for in-school mental health and other services for nearly 1.5 million Medicaid eligible students. Cornell concluded his comments optimistically, summarizing more recent state and federal developments that address social drivers of health, including the creation of the Bureau of Social Determinants of Health in New York State in 2017, the establishment of the Office of Community Partnerships and Health Equity in Louisiana in 2019, and the launching of the California Advancing and Innovating Medi-Cal in 2022. And at the federal level, the 2022 American Rescue Plan included $225 million to train more than 13,000 community health workers. And the 2023 Consolidated Appropriations provided $50 million annually through 2027 to build capacity for the nation's community health worker workforce. In summary, more attention is being paid to social drivers of health, with federal and state dollars following. Social drivers of health are increasingly recognized as integral to overall health. Incorporating social drivers of health into clinical practice is necessary, and advocating for policies that support the integration of social drivers of health is critical.
We appreciate your interest in this presentation. Please visit our website, www.childrenshealthfund.org, or follow us on social media. Thank you.